Okay, my name is Asia Anthony. I'm a nursing student here at the University of South Alabama, and today I'm going to be performing a respiratory trach and care suctioning skill. So here's my badge. So first, I will walk into the patient's room, I perform hand hygiene, and I will introduce myself. And then I am going to start off by verifying order and checking the hospital policy. And then I'm going to use my two identifiers to identify my patient. So Jaguar Jones, A2563, A2563. I'm also assessing for allergies, penicillin, aspirin. So next, I'm going to also check the expiration date on my saline, 8/19. And then I'm going to get ready to position my patient to a workable level. And then put him in semi-fowler or high fowlers. Drop this. And then I will position my trash can, perform hand hygiene, and I will also provide privacy. At this point, I will also put on my gloves, and I will also state that I will also do PPE. I will put on my gown, my mask, my goggles, and then my gloves. Okay, next I will begin assessing for upper and lower respiratory obstruction. And the 4 signs of that is abnormal respiratory rate, gurgles, drooling, and nasal secretions. And then next, I will also be assessing for vital signs and symptoms of hypercapnia and hypoxia. And those are lack of concentration, anxiety, pallor, and cyanosis. So I'm done with that. And I will also state that I would stop suctioning if my rate drops below 20% increase or decrease, or if the is 5% lower than the margin or lower than 90%. So then I will get ready to open my kit, like so. And I will also have placed on my pulse oximeter on my patient. Can I see your finger? At this point, I will now become sterile and remove my gloves. Discarding above the waist. We're gonna open these. Trying to scoop. If I can grab, I might be breaking sterility, so I'm going to go ahead and identify that. I am now scooping with my thumb, making sure my thumb is outward. And I'm breaking sterility. Notifying that I'm breaking sterility, putting on my glove. I'm now going to fix my gloves. Okay. If I can get this to act right. All right. I am now just about sterile. Okay. So next I will place the towel. I would have also did this before I became sterile. I'm also notifying another break in sterility. Now I'm going to reach in and grab my saline. I will open my cap up, put this back in here, place this down. And I'm going to grab this. I'm going to get ready to wrap this. This hand is now, I'm going to wrap this like so. I'm notifying of break instability if I had accidentally touched that. And then I'm going to connect this here. I'm going to get ready to do a practice to make sure that this is working. So I'm going to take this, I'm going to dip it like so. Okay, make sure that it's working. I also would have noted earlier in the video, I would have set my oxygen to 100% and my suction to between 100 and 150. And then I'm going to remove this like so. And now I'm going to get ready to clean it. And I'm going to go in making sure not to touch the outside. I'm going to hyperoxygenate before I do that as well. So I'm going to get 5 breaths. I'm also broke sterility. So, and I will stop suctioning. I might have already mentioned this if it drops below 20 increase or decrease, or below 90 and 5% margin. Now I'm going to get ready to go in without touching my outside and contaminating. So I'm gonna come in. I'm gonna go in until I feel resistance. I'm gonna pull back 1/2 inch, begin suctioning, coming outward, circling. Going to clean, and we're gonna give breath. And then I'm going to come back here again, clean, and I'll come back in, making sure not to touch. I'm not suctioning. Then I'm going to meet resistance, pull back 1/2 inch, begin to come out while suctioning. Okay, clean. That was my last and second pass. So then I'm going to give breath. And I'm going to put my O2 mask back on. And then I'm going to get ready to unhook. I'm done with suctioning. So now I'm going to wrap this like so and get ready to become unsterile and discard above my waist. I would also get ready to compare before and after respiratory assessment to make sure that it has improved or decreased. I perform hand hygiene. Then I will put on my new gloves after I move this out of the way. Notifying if I broke sterility by dropping my hands. I'm now putting on my gloves to begin my care. So now, after I have done that, I'm going to get ready to open my kit, like so. Place that back down. I'm going to get ready to open my sterile field. I'm gonna grab. Shiny side down. And then I'm going to come over here and get ready to dump my contents. At this point, I will also get ready to pour my saline. My cap up. Pour until all thickness is compartments. Okay. Now I'm going to get ready to become sterile. That's crazy. All right. Okay. I'm scooping. Trying to scoop. I have new gloves, so it's not having me a hard time with scooping, so I'm going to notify. Making sure I'm telling you guys I'm making breaking sterility by trying to get my glove with my thumb out. Breaking sterility by trying to place my glove on to save time. And putting my sterile gloves on. Okay, now I can get ready to organize my field. Before I became sterile, I would have already removed my inner cannula and have placed it into the container, stabilizing the plate to remove it and letting it soak at this point. Now that I have let it soak and I am sterile, and I'm going to put my O2 mask back on. Now that I have done that, and I'm back caught up to where I was supposed to be, I will begin by taking this out like so. I'm going to clean it away, brush in and out, discard, and I'm going to drop it into my second container. Let this sit. I'm going to come back here again, and we're going to do like so. Away. I'm going to get my pipe cleaners to clean. Draw on the inside. Discard and get my gauze. Making sure not splashing on my sterile field. We're drying. Discard. Now I'm about to replace. I'm gonna come here, removing O2. Gonna come in at the 3 and go into the 6 while stabilizing the plate. Okay. Put that back on. So now I'm going to get ready to. Also, I'm noting that I would have removed my old thing before I got here, my old gauze, when I removed my inner cannula. And then I am going to now get ready to clean. So I'm going to take my toothpick. I'm going to dip. And we're going to clean while also looking for skin breakdown. Start at the top and come out. Discard. I'm going to come over here and get another one. Dip. Start at the bottom while making sure to get underneath while looking for skin breakdown. Discard. Then I'm going to get another one to clean my faceplate. Discard. Then I'm gonna get a gauze to pat dry. Discard. And I'm going to replace, I'm actually going to get ready to do my ties. I'm gonna put this back on, and I'm gonna get ready to do my ties. So next, I'm going to come here, do my ties, and get ready to tie these. So I will put these in one side. Come around the other side. I'm gonna lift your head, and I'm gonna tie on the other side. I will verbalize that I will be tying today, and it will not be over the carotid artery, and it would be 2 fingers of space to go in between, and it would be double knotted or single knotted. And then I am going to replace my gauze. There, like so. And I'm going to remove the old trach ties. I'm notifying I broke sterility because I thought my scissors was over there. I'm going to cut these. Okay. Removing my old trach tie. Notifying I broke sterility by going beneath my waist. Telling him I am moving this off. Discard. Now I'm going to become unsterile. So, it's glove, skin to skin. Now, I'm going to put on clean gloves. And then I'm going to get ready to compare before and after the assessment. And I'm going to give oral care. Put my O2 back on, and I'm going to give oral care. Discard. And then I'm going to get ready to position my patient, remove the towel, position my patient back into regular position while leaving him in high fowlers or semi-fowlers. Making sure to tell you guys I'm breaking sterility by positioning the bed. And then I will get ready to take off my PPE, and it goes gloves, discard, gown, gloves, goggles, gown, and then my mask. And then I would go back to the nurse's station to document how the patient took this procedure, the type of trach, the size of the trach, if I saw any secretions, and that ends my check off.